So I'm just loosening up the paraspinal muscles here. Let me know when that subsides. Is that a little sensitive?
Yes.
This technique is just so effective for those chronic spinal conditions. Tender in there?
Yes.
If you're someone that suffers from a disc herniation, a disc bulge, or spinal stenosis with leg pain or numbness, you need to watch this video. We have Polician here. Polician, why don't you tell everybody what you came in for originally?
I came here for, I have like, when I have my MRI done, the doctor said I have 2 herniated discs.
Mm-hmm.
I have sciatic nerve.
Sciatic neuropathy. For those of you who can't hear her, she's laying face down with a face mask on. She came in with severe back pain, shooting down the legs, right?
And
She had an MRI done. I have her MRI right here in my hands. I'm going to go over that MRI with you, but more importantly, she started seeing me a couple months ago. Let's get the date right now. Started seeing me in January, right after the new year. And she was having pretty bad pain down your leg, right?
yes.
Now she's studying to be a medical assistant, and before that she was on her feet though a lot. And the reason why she was having that pain was she said that she got an MRI. And right here I have her MRI, and she's allowed me to kind of go over this with you guys. She has a pretty significant disc extrusion. Disc extrusions means some of the disc material has seeped out and it's dripping down. It's irritating other nerves in some cases, or in the spinal canal itself. Disc extrusions can be tricky and can be very symptomatic. We were able to get her leg pain gone at how many visits?
I'm not sure, maybe about 3 or 4.
3 or 4 visits, okay? And you got people going for spinal injections. So if you have a disc herniation, a disc bulge, spinal stenosis, and you want to avoid medication, surgery, injections, you need to watch this video, because in this video we're going to show you some unique approaches to handling these cases. And we've even helped people with post-surgical syndrome, failed back surgery, okay? So no case is too difficult, okay? She has, let's go over this, she's got multiple disc herniations, but all the way up at the top of the lower back at L1, L2, she's got a significant disc herniation with extrusion down the right side, and it's contacting the L2 nerve root. So she was getting pain into the upper leg. L2 controls the thigh up here in the middle of the thigh. And she no longer has that, by the way.
No.
Right?
No, I don't have that anymore.
Good. Okay, now, and then we go next down, we go a little bit further down in the lower back at L4, L5, and L5S1. She's got some spinal canal stenosis and some degenerative changes to the discs with some disc bulges there. But at L5S1, the very bottom disc, she has encroachment of the foramina. So the disc is herniated, down here, herniated, and pressing and irritating the nerves on both sides, both the left and the right side. And just to make things more complicated, she's got a retrolisthesis where the vertebra is shifted back compared to the one above at 2 levels. So a lot going on here. Pressure on both the nerves at L4 and L5, degenerative changes, and a disc extrusion, which is the most difficult. And I think what makes this case a little complicated is she has disc herniations. Her disc problems are at the very top of the low back and the very bottom of the low back. So when you do flexion distraction, we're going to do Cox flexion distraction technique. That's the gold standard here. That has to be done slowly and safely, and we did that in the beginning, and she's doing great. You're not here for any leg pain. You're just having some lower back pain. Yes. Or tightness?
Yes, lower back pain.
Pain, okay. So she's probably been sitting in class all week. So we have to make sure we don't go too low with the hand placement to address L4, L5, S1. We have to keep it above L1 because of that disc extrusion. If I go below that, we have a propensity here to set her off to the point where she will not get off this table. So just because you've have a disc herniation, disc bulge, sciatica, stenosis, and you've been to a chiropractor and it didn't make it better, doesn't mean you had this technique done.
I have arthritis too.
What's that?
Arthritis.
Arthritis too, yeah, the degenerative changes. She's got, as I said, degenerative disc disease and arthritis in the spine, there in the lower spine. So it doesn't mean that every chiropractic technique is the same. They all work differently. This is the gold standard technique for those chronic disc injuries, and I'm going to show you how we do it. So in her situation, we want to loosen up the muscles, and we've been working on her for a while to loosen the muscles up here along the side of the spine, and that tends to really help get more motion from her lumbar spine and free things up when I do that. So sometimes I'll get an elbow in there. When I first saw her, she couldn't take this. Now she can. And take a deep breath in and out. So I'm just loosening up the paraspinal muscles here. Let me know when that subsides. Is that a little sensitive?
Yes.
Okay.
Can I say something, doctor?
Can you what?
Can I say something?
Yeah.
The last chiropractor I've seen.
The last chiropractor you saw? Yeah.
And when he looked at my diagnosis, he said to me, if he put me on the table to stretch me, I would not get off the table.
Yep. So this is a great point. I forgot about this. When she first came in to see me, her other chiropractor turned her away and wouldn't see her. And I think maybe because he was afraid of the disc extrusion. And again, in her situation, she does not want to be put on her side and adjusted that way. Yes, maybe it'll help her 50, 60, 70, 80, maybe 90% of the time. But for her specific condition, it is not the technique to go to. And maybe he just didn't have the tools or didn't have the table or isn't certified in the technique. Because just because you have the table doesn't mean you're certified and you know what you're doing, okay? So it's important to have the doc certified in Cox technique. And tender right there. Is that tender?
Yes.
Yeah. So we went really slow with her, but I mean, I'm not kidding you. 3 or 4 visits and her leg pain was gone, right?
Yes.
So, I mean, and here's a doc that was afraid to touch her. So if you've been to a chiropractor, you've had sciatic nerve pain, you have a disc herniation, and you didn't get help from that chiropractor, seek out a chiropractor that does Cox flexion distraction technique. We're going to put the website down below. You can even type in your zip code and find somebody that's certified near you. We'll put that in the description. If you guys have any questions about Cox technique and what makes it different, I'd be happy to answer that. I will tell you this, Dr. Cox, the inventor of the technique, along with his father. His father was an osteopath. Dr. Cox is a chiropractor. And he actually just had a birthday. And he's out in the Midwest. And he is the pioneer of this technique. And a lot of the studies and the research, along with orthopedic surgeons that he's got on his team, they're all doing their studies out of Indiana University. It's great stuff. Go check out his website, coxtechnique.com, coxtechnic.com. And it's not technique spelled with a Q, but with a, like the old stereo equipment with a C at the end. And that's a great resource. They've got studies there. You can type in, again, your zip code and find a certified doc in the area. We're in New York City. So if you're in the New York area, we're in Manhattan, and you're having this problem, certainly give us a call for a consultation. You feel that? It's all sensitive still. And this is, right here, this is just soft tissue stuff. How good are you about using the lacrosse ball and doing your stretches, honestly?
I'm doing good.
You are? I mean, yes. You're doing them every day?
Yes, every day.
Okay. So, some patients don't. I don't know, some people are really good about it. Some are not so good about it. I believe her. Do you guys believe her? I believe her.
Yeah.
She's doing them every day. I can
Yeah.
feel it in her back. I can tell when patients are not doing their stretches, not doing their exercises. You could use the lacrosse ball maybe a little bit more
Yes,
in this
I
area.
use the ball.
You do? Do you
Yes.
use it against the wall?
Yes.
Okay.
Every single day. Even
Every day, okay.
3 times a day sometimes.
Okay. Wow, okay.
And it works. It helps me a lot.
Yeah. So, deep breath in and out here. Good. This quadratus lumborum muscle right along her lumbar spine is just kind of tight here. So I'm just loosening that up. So when I get in there with the flexion distraction technique, I can really open things up. This technique is just so effective for those chronic spinal conditions. Tender in there?
Yes.
One last thing. Tell me what you think in comments below. I went to film school before I got my doctorate. I do all the writing, directing, producing, sound, editing, and the cool special effects you see here. Folks, I'm not asking for an Academy Award or an Oscar, just a simple thumbs up if you like my video. And don't forget to subscribe to my channel for the latest, greatest content on YouTube. Thank you. Appreciate all of you.
Okay. Now we're going to really open things up. So remember how I said she has a herniation at L1, L2 with a disc extrusion. So it's really important to be effective with this treatment because we can't go too low here. How you doing here, okay?
Okay.
Now some of you may be asking, how do you know if you have a disc herniation or a disc bulge? Well, if you have pain or tingling down into the feet or toes, and it's not something like diabetes, then there's a good chance you have a disc bulge or herniation. The only way to tell that is an MRI or a CT scan, preferably an MRI. That's the only way to tell whether or not you have a disc herniation or a disc bulge. An X-ray can tell if you have disc degeneration, where the disc is wearing down or losing fluid. But that's it. It will not tell you whether it's herniated or bulged. So I want to make that clear and differentiate between the X-ray and the MRI. X-ray looks at hard tissue, MRI looks at soft tissue. But again, you can see the height of the disc space on an X-ray on a lateral view. Pretty good. You can see whether the disc is desiccated or dehydrated or losing some fluid, whether it's degenerative or not. But if you think you might have a disc herniation, best thing to do is get an MRI. If you have any metal or hardware inside your body from post-surgeries, then, you know, you might need a CT scan instead of an MRI. Okay, now we're going to use a mixture of Thompson technique. So I just did Cox flexion distraction technique. Okay, keep your legs straight. Raise one leg as high as you can. Good. All right, and the other one? Okay. How does that feel? Do they both feel equal?
Yes.
Great. Okay. Turn over on this side. Then you're going to face that way. So I'm going to show you a little bit of ART, what we do for people with sciatic neuropathy. You slide down a little so your shoulder's comfortable there. Slide down. There we go. Okay. You're going to swing your leg and try to kick towards the bag there on the chair. Yep. And back. Bring your leg all the way back against my leg. Like this. And then you're going to bring it forward. And then bring it back. Go ahead. This is called ART. This helps to release some of the muscles, especially in the piriformis and in the glute medius, glute maximus. You can do ART on just about every muscle in the body. This is another soft tissue technique we use. Good. That's what's really unique. Go ahead, other side. We're gonna do the same thing on the other side. That's what's really unique about seeing a chiropractor, right? So a lot of times a doctor will send you to a physical therapist for sciatica, and all they do is soft tissue work. But at a chiropractor's office, you're gonna get soft tissue work, you can get the Cox flexion distraction technique, which is the gold standard for sciatic neuropathy. Think about it, sciatic neuropathy is a pinched nerve. How is muscle work gonna fix a pinched nerve when that pinched nerve is coming from the spine, right? So the advantage that chiropractors have is they can treat the soft tissue with active release technique and many other soft tissue techniques. They can go in there and adjust and manipulate the spine, take pressure off the nerve and the discs. Then on top of that, they can do other things like cold laser therapy, which we do in some severe sciatica cases as well. So many tools in our arsenal to deal with pinched nerves. PTs just have the myofascial part of it, okay? You're not gonna get the rest of that sciatic neuropathy treatment that you would get with a chiropractor. And you're gonna do the same thing here. Go ahead. Yep, and bring your leg back against mine. Yep, and again. Good. And a little bit faster. Good. 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 Now lay on your back. Cross your arms in front of you. So this is an area that commonly gets locked up. You'll see me do this adjustment a lot, the thoracolumbar area. Some people can't take that adjustment face down. So I like to do it this way. It's hard on my hands, but easier on the patient. Tuck your chin down, take a deep breath in, do a half a sit up, and blow out. But everybody loves this adjustment, and relax here. Good. How you doing there? Can you take a deeper breath? Take a deep breath. So that's the area where the diaphragm is. So a lot of people find they can breathe easier that way. And relax here. Relax here. Good. Now, a lot of people ask, why would you adjust her neck if she's come in for lower back pain and herniations in her lower back? It's a great question. The reason is we have a dura mater. That dura mater is a thin sheath that connects our tailbone all the way to our skull bone. So when the skull bone or something's out of position up on the top, something on the bottom is out of position. It's all connected by the dura mater. And it's all even connected to our nerves, our spinal nerves. It's a sheath that goes around our spinal cord, our nerves. Google it, dura mater, okay? All right, I'm gonna have you roll over onto your side. This is the correct way to get up. If you have a disc herniation, roll over onto your side. You're gonna show them how to do it. You remember?
I remember.
Roll all the way onto the side, yeah. Then she's gonna push off that hand and elbow, swing her legs down at the same time. There we go, and sit up that way. That's how to do it. Thanks for tuning in. If you guys have any questions or comments or want to know anything about disc herniation, spinal stenosis, disc extrusions, comment below. Thanks for tuning in.